think Destiny may be able to answer that better than me. What do you think? Destiny, would you like to answer that question when it comes to Nigeria and what you feel like would really help improve their implementation of pharmacogenomics?
Yeah, sure, sure. I would definitely. The challenges we're having currently, I think there's been some research that has been done in the field of pharmacogenomics. But like I mentioned during the introduction, more research has to be done. And there's still the aspects of the policy that we have to get right. So I think there's been efforts generally to try to improve the 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 way that we see the way that the pharmacists can actually handle and do a lot of the things that relates to the patient's care. And I think some of those would really impact how we move going forward. And the other aspect is actually the the apparatus, the equipment that are needed to do this pharmacogenomics testing. I don't think we still have them currently in Nigeria. I don't know of any center currently in Nigeria except one that is in Lagos. So I think those are the challenges, but with time, I think we would be able to supersede those ones. Yeah, I don't know if that answers your questions. Okay, I think I'll take the next question now. Um, okay, I see the question from um, I see the question from Silva Spring. I think that question has been answered. If you would agree, Silva. So I'll just move to the next question so we save time. Please, I want to know the role of pharmacogenomics in curbing brain infections. That's the next question. The role of pharmacogenomics in curbing brain infections.
So I heard the role of pharmacogenomics in
Hello.
brain infarctions,
In curbing brain infections.
in coping.
Yeah, in curbing brain infections. That's what he asked.
So I'm not sure what you mean by encoding, but I understand what you mean by brain. That?
Like perhaps in preventing brain
Oh,
infection. Yeah.
got it. Awesome. Okay. So I think you meant to
I did.
encoding. Got it. Got it. That makes sense. Okay.
I
So
did
yes,
before. You
great
just did.
question.
Like,
So pretty much you're
I don't
saying
understand
preventing
you.
brain infarction like stroke.
I'm with it. I'm with it.
Definitely
When I'm
very,
done,
very
I'll bring it
important
for
ways
you.
that we can
Please.
improve it. First of
I'm with
all,
it. When I'm
we
done, I'll
talked
bring it for you.
briskly about
Please.
like the antiplatelets medications and anticoagulants like warfarin and how that's being used because those are used and how we can better tailor treatments in general. So in general, when it comes to pharmacogenomics, it's been used for medication selection. It helps them determine, if there is a higher risk of adverse events when these patients take treatments to prevent stroke. Like I said, warfarin or clopidogrel; those are antiplatelets. The second piece is optimizing drug dosages. That influences how because again these when you know the genetic profile and the genetic variants relating to enzyme metabolism in each individual, right, and how they're going to respond to the medication, then you can optimize the drug dose in order to provide the desired therapeutic effect and minimizing the risks and also minimizing the risk of side effects in general. In addition, identifying genetic risk factors, that's something that has been used as well. So certain genetic variations have been associated with an increased risk of cardiovascular diseases, including strokes. So they have noted and identified a few individuals with genetically predispositions to developing that conditions. So the goal is if you know earlier on, like any other condition, you can use it to tailor preventative strategies and lifestyle modifications to reduce the overall risk of having a stroke. And lastly but not least, it just really allows them to create a better treatment outcome when they know all this information on point, whether it's to really prevent or reduce the incidence of strokes in any risk of population. So people that have the genetic predisposition or if they don't. I hope that answered that question.
Okay. I think we still have some questions. I don't know. Would it be
Sure, go
fine?
Hello.
for it.
Sorry. Can I add something to the question on research centers and some groups that are working
Okay, okay, sure, please,
on
please do,
pharmacogenomics.
please do. Thank you.
Recently, I attended a training, 2 days training, a workshop at Nova Federal University where you live there. And in respect of Professor Oluseyi Bolaji, who just retired, he has been working with some group in Zimbabwe, and they organize the African Genomics. It's a particular group. And then when I get the details, I will send them to you. So I think they've worked well with some other professions outside pharmacy also. So I think the entire of Lagos, I would like to know where it is also because I'm currently in Lagos also. And I can tell you that group in Ife also, they are doing a great job in terms of genomics.
It's awesome. That's
Fantastic.
exciting. Thank you for sharing.
Thank you so much. Okay. I would really like to reach out to you after the call, please. So we'll talk more about that. Thank you so much. I don't think I understand the next question here. Please, an I'm an animal scientist. How can pharmacogenomics okay, I think how pharmacogenomics is related to economic traits like milk older size in cattle. I don't know
Sorry, could you repeat the last call? You said, how can pharmacogenomics relate to what was the I didn't hear the last part?
how pharmacogenomics is related to economic traits like milk older size in cattle.
Oh, okay. Economic traits in animals or humans?
In animals, in cattle this time, in cattle.
In cattle? Oh, so like the size of the cattle. Is
Okay,
that correct?
sorry.
Is that what he means? Is that what he means? He's asking about the economic traits, size of the cattle, or the strength of the cattle. Is that what he's asking?
Abdul Karim, are you on the call? Please, you can help us. Abdul Karim Shitu. Okay, I think we would move to the next question. Yes, I think we should move to the next question. This is from Stephen
Okay.
Audu. What's the current diagnostic sensitivity and specificity of pharmacogenomics?
I'm sorry. Could you? I couldn't hear you very well.
What is the current diagnostic sensitivity and specificity of pharmacogenomics?
I could definitely answer that question for you. Would you like me to answer the one before that? Just a general question. I could just provide some basics about things they can consider.
Sure, sure, sure.
Okay, sure. I'll answer both. So the first one about the cattle, just a few things just from what I know so far, and I can definitely look into this further. When it comes to cattle breeding and production and just an animal, genetic markers are critical as well, and they're associated with traits like growth rate, muscle development, and an overall strength of the cattle, right? So when you understand how specific genes influence these traits, right, the breeders can selectively breed cattle with desired characteristics that should lead to improved productivity and economic outcomes. So that's one key element you can think of. When it comes to precision, there's something called precision livestock farming that's also very famous too or popular. They have been using pharmacogenomic information, farmers, to implement this precision livestock farming technique, and it helps them tailor management practices. This approach can help whether it comes to optimizing feeding regimens to see like some cattle will do better with specific feeding regimens. If they're sick or they have any genetic predispositions to sickness, they can provide the appropriate healthcare interventions and breeding strategies to really maximize their growth. Now, when it comes to a same thing like humans, right? You can keep it in mind when it comes to cattle health and performance monitoring. So you can also use pharmacogenomics if in the case where the cattle is a little sick and you actually are providing certain medications or treatments like humans, and you can definitely see how they're responding to the medications. And then also like humans, epigenetics is always going to play a role, environmental adaptations. So like we said, there is some kind of mysterious interplay between genetic coding and decoding and the environment. So some genetic markers identified through pharmacogenomics may be linked to traits relating to the environmental adaptation, like heat tolerance or disease resistance. So when you select a cattle genetic predisposition that enhances their ability to thrive in specific environmental conditions, so they can help you reduce production risks and improve overall economic sustainability. So that's just in general when it comes to precision farming. And now the next question you asked about was current diagnostic sensitivity of pharmacogenomics. Now, obviously, I can definitely look into this further, but I can tell what I know so far. Since like September 2021, there was a recent study that I was reading about diagnostic sensitivity, and it was saying how it can vary depending on the specific genetic test, right? So target genes or various variants being analyzed and technology being used, right? So the type of technology, genetic testing that you're using, and also the gene that's being used. Now, genetic sensitivity refers to the proportion of individuals with a particular genetic variant or biomarker who are currently identified as positive. So, in the case of pharmacogenetics, diagnostic sensitivity is crucial, right? It's definitely important and in predicting how we respond. However, it is important to know that there's a lot more work and testing that needs to be done in order to be more specific and make sure that based on and look through all the other genes that as I told you earlier, we know as of right now we're looking at 10%. That was the stats of our genes that are impacting, or at least that's what we know so far, right? That are impacting our response to medications and our metabolism of the medication. There are still genes we don't know what exactly they even do. So, so we don't know yet everything about genomics, and we are hoping with additional research that we do provide further insight to providers. Now, the newer testing methods, like in general, I can tell you next generation sequencing and targeted genotyping arrays. Those are considered to be one of the most sensitive. So if you want to come to like the most advanced technologies and says which one has the most improved, definitely keep those two in mind. The next generation sequencing and those targeted genotyping arrays that I mentioned, or microarrays, they are considered one of the most sensitive and have the ability to detect a very broad range of genetic variances associated with drug responses. I do hope that answers your question.
Great. Great, great. Thank you so much. Thank you so much.
Mhm.
I
Of
think
course.
we basically have covered every questions. The other questions I'm seeing are in one way or another related to the ones that have been taken earlier. So thank you so much, Dr. Luma. I think we have taken enough questions. I don't know if it will be fine for people to reach out, to connect, maybe on LinkedIn.
Yes,
If you could drop your LinkedIn
absolutely.
profile link so people can reach out and perhaps they have other questions. Thank you so much. It's been
You're,
very awesome.
you're welcome to say something. Add one last note before we. First of all, it was such a pleasure meeting everyone. I do hope please feel free to contact me through LinkedIn. I do a Facebook account. I don't use it that much, but LinkedIn works, or email as well. Destiny, please provide them with my email at any time if you have any questions. I do believe there was two key questions that I made a note of that I didn't have the most accurate answer to that I promise I will follow up on. I believe one of them was the power informatics and in silico, and any advancements with respect to pharmacogenomics, any institutions that are really at the forefront of that type of technology. I will get back to you on that, I promise. And then the other one was the HIV, the specific statistics. I'll definitely look up on that and see what has been done thus far when it comes to the use of pharmacogenomics in HIV. How prevalent is it? How popular is it? So, thank you again so much. It was a pleasure to meet everyone. I'll let Destiny kind of end it for today. Have a wonderful, wonderful weekend.
Thank you so much. Thank you so much. For those of us who asked for the slides, they would be provided. They'll be provided in the waiting room. And I know some of us still have questions. I can see comments in the room now. Mr. Agbo, I'm really sorry. We would have to end it now. I would be glad to have your questions, perhaps in the waiting room, and I could send them to Dr. Luma. And when she provides answer, I'll send them to you personally, if that will be fine. Dr. Luma, would that be great? Okay, thank you so much. Thank you so much. All right. Thank you so much, everyone, for participating. It's been really awesome. Today being the second day of the workshop, and also the certificates of participation will be provided most likely very very soon, very very soon. So look out for that. Provided you registered for the session, you attended at least one of the sessions, you're going to get a certificate of participation. We'll show you of that. So thank you so much for participating. Once again, thank you so much. Good night, everyone. It's a good night from here. Thank you so much, Dr. Luma. Thank you so much.
Thank you.
Thank you, Dr. Luma.